starting point is the body's natural default mode is always to move towards wellness. So we're not asking the body to do anything that's not already trying to do. It already knows how to fix your problem. Something's gotten in the way. And if you can get this something out of the way, the body goes, thank you. All right, I've been waiting this however many years I've had this issue. I've been waiting to fix this. I'm ready to go now.
Hello, everybody. This is Dr. Connors. Welcome to another episode of Connors Clinic Live. We have a great guest today. Dr. B has been working with functional medicine, integrative medicine approach to autoimmune disease for a long time. He graduated, 30 years ago. You've been in practice. I'm going to let you kind of fill in the gaps of that and kind of, I guess I'm interested in how you got into what you're doing, because most people that graduate with a medical degree are pushing pharmaceuticals. What changed in your life?
Well, one of the first things was my original area of specialty was physical medicine and rehab. And so my subspecialty was spinal cord injury. So everybody was paralyzed from the neck down, waist down, and very complex medical issues involving every body part. But they were very sensitive to medications. And so if you were using a medication for something like, spasticity or pain or, nerve pain or bowel bladder issues, we might get to the dose of the medicine that was just helping them, but then the side effects became so problematic, we had to stop it, try something different, and you can run out of medications. And because very simple things that most people wouldn't think twice about using that were able-bodied, like just something for nasal congestion, actually for that population, it could kill them. And so, when we kind of would run out of options, I'm like, geez, wouldn't it be lovely if there's something out there that could help these people? And wouldn't it be fantastic if it didn't have any side effects?
Now, is that common with people with spinal cord injuries to be hypersensitive to medication? Is it because they had so much medication that their liver is so congested, or?
Well, it's more inherent in the disruption of the nervous system and all these kind of feedback loops that are lost that, what an able-bodied person might see as a very small side effect, like, hey, I'm getting constipated. For them, they get constipated, the autonomic nervous system kicks in, and they could actually stroke out.
Wow.
Kind of a thing. And so what's, a little thing for us would be a big thing for them. Thus, the rehab docs end up becoming the primary care physicians, because we had to have just such intimate knowledge of the spinal cord injury to take care about anything. But that's where I found acupuncture, and I ended up training out of UCLA, become board certified in acupuncture, thinking, well, this will be, one extra thing we have to offer. And as far as I can tell, there's no side effects. Well, if you need to know a spinal cord injury to be their primary care docs, maybe you need to know spinal cord injury to be their acupuncturist as well. And where I was at back then in the early 90s, there wasn't any acupuncturist anyway, but also I worked at a really large medical center in Charlotte where we had over 200 rehabilitation beds for like everything you can imagine, not just spinal cord injury, but traumatic brain injury, rheumatoid arthritis, strokes, pediatrics, all this kind of stuff. And we were the place that people got sent when nobody else could help them. But if we couldn't help them, we had no place to send them. So all my partners were so excited that we'd have something else to offer them. And so pretty much right from the get-go, I got all the worst of the worst people that we couldn't help. And unbelievably, it worked so great. So great to the point where... I just find it fascinating that back in the 90s,
you had a clinic group that was open-minded enough to let you do acupuncture. That's in itself a miracle.
Well, you're very astute, Kevin, because, we had so many dollars every year to spend and days away from the office for continuing medical education. And so when I presented this to go to UCLA and train, they're like, well, we'll give you the days off, but you can't use your CME money for it.
Sure.
You have to pay for it yourself. I go, oh, okay. But then it works so well, almost right away. I was seeing like 100 patients a week. Well, of course, 2 years after I started, one of my really good friends and one of my partners decided, well, he wanted to do it too. Well, then had seen how great it was, and they let him use a CME money for it.
Wow.
They're like, oh, yeah, okay. Yeah, probably should have figured a UCLA course. It would be worthwhile anyway. But then that got me in this whole journey of, well, so what else is out there that, of course, I didn't learn in my traditional allopathic medical training that could help these folks and that had, not nearly the side effects or no side effects compared to the pharmaceutical agents. And this has been like a 30-year journey to learn all this stuff. And then from there, I got into integrated medicine, whether it was nutritional therapy, herbal therapy, energy medicine, manual therapy, all this. And then having known all this, my son, about 3 or 4 years of age, terrible allergies, terrible asthma. And there was no kid I couldn't make their asthma go away with acupuncture. So I'm like, oh, this will be a piece of cake. So the asthma went away, but his darn allergies were so stubborn. We took him every place. And ultimately, nobody could help him. He was totally miserable. And I said, well, I'm going to have to figure this out myself. And that's where I discovered functional medicine, which basically is kind of answering the question of, so why do people get health issues? And if you can figure out why somebody's got a health issue, you're in a good position to reverse the process, make it go away. Sure enough, his went away, and I go, oh, I like this stuff. And then I kept seeing more and more people, especially women, coming in with autoimmune disease, where the immune system's become confused and starts attacking our own body parts, which is really crazy.
In private practice by that time?
By that time I was, yeah. And I was running a big integrated medicine clinic outside Chicago with all the different integrated practitioners. And to me, it was fascinating, this functional medicine, because in acupuncture, you really got to get at the central mechanism that's driving not only their primary complaint, but because it's a central mechanism, you put in a position to make everything get better at the same time. But this is where acupuncture, you can't do like the same acupuncture treatment for everybody who's got low back pain, because everybody with low back pain is a different individual. You got to, make it special for each individual, the very best in individualized care. And then functional medicine is very much the same. So you may have, 100 people with rheumatoid arthritis, 100 kids with juvenile rheumatoid arthritis, for example, but you got to treat each one individually. So it's really the best in personalized medicine, but by addressing the big central mechanisms of why they have their main thing, you're putting them in a position to fix kind of everything else at the same time. So, here you have this autoimmune disease, you're attacking a certain body part. Rheumatoid arthritis would be joints, ulcerative colitis, Crohn's is gut, multiple sclerosis is brain. Neurologic ones will drive seizures, migraine headaches, neuropathies, all this kind of stuff. And actually 70% of all autism is one particular autoimmune disease. But by getting at the central mechanism, you help stop the attacking of the body part, and their autoimmune disease stops progressing, goes backwards, and ideally, if everything works well, you get rid of it, but you're also taking care of all the other things that the Y is doing. So here's memory and concentration issues, they get better. Here's, depression, anxiety, it gets better. Here's their constipation, diarrhea, it gets better. Here's their fibromyalgia, it gets better, because you're really getting at these central mechanisms that then put the body in a position to really kind of do what it's supposed to do, which is fix itself.
Well, and you and I both know, and anybody who's listening to this would agree, that the general practice of medicine dealing with autoimmune disease is just basically non-existent as far as helping these people, except getting them on some biological drug or something like that. So you mentioned rheumatoid arthritis. Let's use that as an example. So if you had a rheumatoid arthritis patient come to your clinic, what would a workup look like?
Yeah, and that's another reason why I think it speaks to a lot of people, because when people are used to working in the kind of Western traditional allopathic model, well, you do testing. Okay, so I got this issue. Well, let's do some testing. Now, the testing that we would do is much more specific for what drives chronic disease. So like you might do blood work, go to a lab, have your blood work done. Now, also because we know what causes the disruption of the immune system. And I think, with your interest in cancer, it's very important for people to know that the immune system, we now know it is an integral part of every chronic disease. So the immune system, as I explain it to patients, is a great example of how the body likes balance. So you don't want to be too high, too low in anything, blood pressure, blood sugar. There's always a sweet spot right in the middle. in the immune system, when you lose that set point, you actually move away from it up and down at the same time. So the overactive, upregulated immune system issues are things like autoimmune disease, but also, like my son, allergies, asthma, and then eczema. Well, the underactive immune system things are infections and cancer. And so when somebody presents with an upregulated issue, like an autoimmune disease, like rheumatoid arthritis, for example, we go, oh, you lost your set point, your immune system moved up and down. We know why that is, but it's so important for us to address why and fix it, because if we don't, your autoimmune disease will just getting worse and worse over time. But also, you're going to get another autoimmune disease on top of your first, second, third, and fourth. I can't tell you how many women in their 20s already, by the time we see them, have 5 autoimmune diseases. But also, they have a huge increased risk of cancer. So the things that cause this disruption of the immune system are vitamin deficiencies, hormone imbalances and deficiencies. The stress hormone cortisol has become disrupted. Infections, we call them like the hidden infections, not infections that tend to cause obvious infections with like an increased fever, increased temp and all this. They drive chronic disease, such as Epstein-Barr virus, herpes virus 6, these guys. And then environmental toxins love to throw off the immune system. And then the gut. And the gut's the real big central mechanism driving basically kind of all these different things that cause this disruption in the immune system. A really big thing that we kind of tend to find that gets missed by people is the infections that are hidden, but also for women, and this is one reason why they believe that 80% of people that get autoimmune disease is one particular hormone imbalance called estrogen dominance, where women get too much estrogen compared to progesterone. And it is super common. When you look at everything, it probably accounts for almost 90% of the reason why women die. So traditionally, it'll show up as all the hormonal menstrual things like bad flows, bad cramps, PMS, ovarian cysts, breast cysts, fibroids, endometriosis. But also because estrogen revs and progesterone calms, it'll also show up as excessive worry, anxiety, panic attacks, insomnia. So whenever some woman has any of these hormonal menstrual things or rev with all calm things, you go, oh, you have estrogen dominance. This is a humongo driver of autoimmune disease and cancer risk. So like women that have estrogen dominance before menopause have a 5.4 times greater risk of getting breast cancer before menopause. Not just double the risk, not 3 times the risk, but 5.4 times the risk, and a 10 times greater risk of getting malignant cancers their entire life. And so
you attribute that mainly to the xenoestrogens in the environment that people are exposed to, or the estrogen disruptors? What do you mainly attribute?
That's part of that environmental toxicity thing, yeah. But also because the gut becomes disrupted, women can't clear old toxic estrogens from their system, including old toxic, xenoestrogens. So old toxic estrogens rise, estradiol and estrone, but then when cortisol, the stress hormone, gets thrown off, because of potentially toxicity, including the estrogen disruptors and all this, but other kind of things like infections cause stress, vitamin deficiencies cause stress. The cortisol gets kicked up into the stress mode, this fight or flight mode, and the first hormone that gets depleted when this happens is progesterone. So you got this combination of things that drive up estrogen, bunch of stuff that drives down progesterone. Here's this estrogen dominance. And kind of to your point, in our kind of traditional system, especially when it comes to the hormonal menstrual things, the thing that women are given is birth control pills. Well, if you got terrible flows, bad cramps, PMS, ovarian cysts, we'll just give you birth control pills. But they're estrogen based, and they make the estrogen dominance worse. And so what we're trying to do is, well, women that have these autoimmune diseases, estrogen dominance is always part of it. Let's fix this as well as these other things. Because you don't need your autoimmune disease. You also don't need cancer. But also we're trying to teach people, mothers, for example, that see this in their daughters, well, let's fix it and get rid of all the hormonal menstrual stuff, which would be lovely. Let's get rid of the rev without calm, which would be lovely, because so many young women, for example, panic attacks, anxiety, all this brain stuff, and oh my goodness, the suicide rate has gone up so high. Let's fix it now, and all those things get better. But then we're really doing our due diligence to protect you from autoimmune disease and cancer at the same time.
Yeah, huge issue, right?
Big.
Yeah. And now you see it all, the hormone issues that we have with men as well, driving different cancers and driving different disorders and emotional problems, and just throwing off the sympathetic parasympathetic balance. And so when a person comes into your office, what kind of testing do you look at
Thank
first?
you. Oh, thank you. I'm sorry. So I got kind of a little bit of a tangent there.
No. Very good tangent.
But it goes back to kind of then the blood work, where we look at specific vitamins minerals that might be low. We look really closely at these hormones, including the estrogen, progesterone, even in testosterone. So the typical ones would be DHEA, pregnenolone, testosterone, estradiol, estrone, progesterone. Of course, the thyroid, close look at thyroid, close look at insulin and blood sugar. Now, typically, we might do a saliva test for cortisol. That's the gold standard. Testing for cortisol, blood testing for cortisol is totally inaccurate. Usually, because the gut's such a central mechanism, we'd ask people to do a digestive stool analysis to get a really good sense of what's going on with the gut. Things like the good bacterial numbers, the warriors fighting your battles for you, bad bacteria that might be in your gut creating issues like infections, inflammation markers that will tell us that if you're moving towards new disease like colon cancer, ulcerative colitis, Crohn's disease. We want to reel that in before you get there. And then a really big one is, the good bacteria in the gut make so many important things. They're the biggest hormone producers in the body, the good bacteria. They make these things called short-chain fatty acids. A really big one's called butyrate. Butyrate's uber important to keep away inflammation in the gut, keep away colon cancer, this kind of stuff. But butyrate, almost working exclusively through epigenetics, where it'll turn off bad genes in our cells, turn on good genes in our cells. And the DNA tells the cells what to do, the genes do. It prevents cancer 5 different ways. It actually can treat cancer 5 different ways. It's great for the brain. It's great to keep away obesity and reverse obesity. It helps kids with cystic fibrosis, where they're basically drowning on their own secretions. It helps the brain recover after an ischemic stroke. And so once again, it's just another good example of how these good bacteria in the gut make such important things, including this butyrate, which we use an absolute ton because it's so important to getting not only the gut healthy, but really getting the body to get healthy in general.
Right. Back in the day, I remember, in functional medicine, we used to talk about everything starts in the gut. Well, now we know everything doesn't start in the gut, but you have to heal the gut. Almost everybody that comes in with a health problem also has a gut issue. Mm-hmm. So dealing with, the body's ability to make butyric acid, either with insoluble fibers, or now you can just use butyric acid straight. It's just a game changer for healing the gut. Now, all the tests that you just talked about, for somebody who isn't familiar with functional medicine, you probably get people still coming into your office that say, "Oh, I've been to the doctor. I've had a ton of tests. Everything is normal. They can't figure it." Well, they're not doing any of the tests that you spoke of, except maybe taking a TSH and a T3 or something and calling that a thyroid panel. So. Yep. These are functional medicine tests. If you're going to a functional medicine specialist that knows how to look at these tests, I've had people come in and have actually had good testing done, and then the naturopath that maybe ran the test didn't understand them themselves, so never gave the person correct advice on how to deal with the things that were positive on the test. That's a common thing.
That's so true, because you have to know the test to run, but you also really have to know how to interpret the test results. Absolutely. Yes.
So, you're really speaking to the choir as far as, there's always a cause, right? With every disease, it's not something like genetically you inherited 99% of the time. There's a cause, and it's environmental, and it is something that's disrupted in your metabolic pathways that needs to be uncovered. And you're, basically talking about digging to find that cause. And usually there's multiple causes, and treating those things. And at least I heard you say you're basically, when you're treating autoimmune disease, you're basically just cleaning up all this other stuff on the patient. And lots of times you can just put the autoimmune disease in remission. So
that's right.
what are some, you talked about the hormonal issues with women and such. When you're talking about the arthritis, what are some common things that you find with those?
With what? Which ones?
With like rheumatoid arthritis, psoriatic arthritis.
Yeah. So it kind of to your point also is that there's a lot of people out there much more knowledgeable nowadays than there used to be as far as some of these functional medicine principles. But there's some things that I tend to find always get missed, and one is the infections. People always miss that infections are really part of all chronic disease. And so things like Epstein-Barr virus, herpes virus 6, Coxsackie virus, mycoplasma, a whole bunch of ones in the gut, including some of the data out there about Epstein-Barr virus, herpes virus 6 driving childhood leukemias, for example. So this is kind of that they talk about cancer being the flip side of the same coin as autoimmune disease. And so they miss the infections, they miss how to get rid of them. Another thing that gets mixed is the vitamin D receptors in the gut become resistant to vitamin D. And people know how important vitamin D is, including, the thing we share with women is if a woman's vitamin D is above 60, she's automatically decreased her risk of getting breast cancer by 82%. It's so great for the immune system. But also keep away autoimmune disease. So like if a woman's vitamin D is above 50 during pregnancy, she automatically decreases the risk of her child ever getting multiple sclerosis by 50%. But every cell in the body has receptors for the things that the cell needs to function so that that thing can attach, tell the cell what to do, go into this, tell the cell what to do. But these vitamin D receptors, particularly the ones in the gut, can become resistant to vitamin D. And that is a whole domino effect of terrible stuff. And when you fix it, it's a whole domino effect of all this great stuff, including by optimizing the intestinal microbiome, you can get rid of pretty much any autoimmune disease. It's been called the nuclear weapon against diabetes and metabolic syndrome. If you fix the intestinal microbiome this way, Harvard Journal of Psychiatry a year ago says, wow, you can treat major depressive disorder with this. And the triad that we call the foundational triad to fix this is daily vitamin D, daily probiotic. Those two most people know about. And the third one is the use of butyrate. And that triad has been shown to fix this vitamin D receptor resistance. And then just this beautiful domino effect of great stuff happens. But kind of to your point, each one of these individually is so cool. So like probiotics, you get your benefit from probiotics if you can fix the vitamin D receptor. But by probiotics will help protect people from getting diabetes from BPA, the estrogen disruptor that's in plastic water bottles, and then the phthalates that are in like cosmetic products will drive people to diabetes. But the probiotics actually protect people from that driving towards diabetes. And so you kind of get a chance to see sort of like these real big central mechanisms in the body that if you can fix them, you can reverse pretty much anything. Though with the autoimmune disease, we love to use something called low dose naltrexone, which at very teensy weensy pixie dust doses, no side effects. If people look up naltrexone at the high doses that's used for addictions, they'll go, oh, there's a lot of side effects. But at pixie dust doses, no side effects, but it's an immunomodulator and it helps you rebalance the immune system. And so it helps us get rid of those infections and then keep them away. But also it gets rid of the upregulated immune system stuff like allergies, asthma, and autoimmune disease. And then because it works through two really big central mechanisms and inflammation control in general, it'll help. It's great for the brain, can take care of any pain problem, can help people lose weight. But also, if you can get rid of this inflammation by fixing these two mechanisms, you're really in a position to turn around any of the chronic health issues.
And that's the key of the vitamin D also as a Treg stimulator, immune modulator. It calms down a hyperimmune response and can stimulate a hypoimmune response. And I think some of the listeners may not understand what the importance of butyrate in healing the gut. I mean, that is the main fuel source for all the epithelial cells that line the gut. So, you talk about, you mentioned multiple times about fixing that vitamin D receptor in the gut. That really has to do with helping the gut cells heal. Is that right?
Yeah. Yep. So it optimizes that intestinal microbiome. You build up all the good guys, get rid of the bad guys. The lining of the gut stops making chemicals that create inflammation. So when you get this disruption in the gut, the lining of the gut actually is making chemicals that create inflammation, like a really big one's called NF kappa beta. It just creates inflammation. Well, if you fix the intestinal microbiome this way, it stops doing that. But then also the lining of the gut starts making proteins called antimicrobial peptides that protect the gut from bad bugs ever rearing their ugly head again.
Yeah. Key things. What would you say if we're going to kind of close this out? What would the key factors, if somebody's listening to this and go, oh, okay, wow, this is a lot to kind of take in. Well, what would be a starting point for a person?
I think one thing to know is, as a starting point, is the body's natural default mode is always to move towards wellness. So we're not asking the body to do anything that's not already trying to do. It already knows how to fix your problem. Something's gotten in the way. And if you can get this something out of the way, the body goes, thank you. All right. I've been waiting this however many years I've had this issue. I've been waiting to fix this. I'm ready to go now. So you always want to create calm. You got to create calm and let cortisol find that calm mode rather than the stress mode. So this is where things like getting out in nature, deep breathing, meditation, all the different ways you can create calm. You got to get rid of these hidden infections. You want to fix the vitamin D receptor resistance. And you want to really shift, because of the kind of foods that people eat nowadays, you really got to shift away from food-like substances, like the highly processed food-like substances and the fast foods. They're not even foods. There's like food-like substance, and more the real food. I have a cute little sticker a little thing on my desk that it says organic food, what my grandparents called food.
Exactly.
That's a big one.
Kind of just sad.
It is. And that's a big one. That gets rid of a big block, because if you kind of move away from those kind of things and eat kind of the real stuff, then your body's like, oh, right, I'm in a position to fix this stuff.
Well, thank you very much for being a guest, Dr. David Bilstrom. Dr. B, as your patients know you as, practicing in Idaho, seeing people from around the country. We'll have your information for people to contact you and your website for people to find you, drive some people your way, and just continue to help people. Before we started recording, you said you're on a mission to basically change the way that people treat autoimmune disease worldwide. It's a big mission.
Well, it's always important to have goals.
Yes.
We are translating some of my stuff into French now, because I've been lecturing a lot in North Africa for French speakers there, and in France and Belgium, and there's a big need there, just like there is in Canada, the United States as well. Right.
Well, thank you for all you do. I know the listeners are just, take little pieces away from all our lectures, and this is a lot of really good little pieces there.
Thank you so much for having me, Kevin. I sure appreciate it.
I'd love to have you again.
It'll be my pleasure.
Okay. Bye-bye.